Hi everyone, welcome back to this quick tutorial number 19 where we continue talking about that special kind of verb in English called a modal verb or a helping verb. And we said back in quick tutorial 18 that modal verbs are not like normal verbs in English because, for example, they do not have past tense forms like I eat, I ate. That does not happen with modal verbs. They always stay the same. They also do not have singular and plural forms. So for example, I take, you take, he, she, it takes. Modal verbs don't do that. They always stay the same. And because they're helping verbs, they always need to have a main verb in the sentence. They cannot be the only verb in a sentence. So today the modal verb we're going to look at is must. And must is the modal verb when it comes to what is called obligation. That is, the person has no choice, at least not without a bad result. So let us say this patient here is starting with a doctor who is going to put her on treatment. So we tell her, you must tell the doctor about all your medications so there are no problems. Maybe she does not mention a medication she's taking, the doctor prescribes something new, and there is a bad interaction. So she must tell the doctor about all her medications. Similarly, maybe she's getting a procedure done tomorrow. You say, you must not eat the night before your procedure. Maybe she has to be put to sleep, and as you know, her stomach needs to be empty. So if she eats before her procedure, what do? They cancel the procedure. Must is used to talk about that obligation then in the present and the future. So then how do we talk about obligation in the past? Say yesterday or last week. Well, as it so happens, there is another verb phrase that means exactly the same as must, and that is have to. And have, as you know, is a normal verb in English that changes depending on present past or singular or plural. So here we have the simple present tense. You can say I have to do something. You, we, or they have to do something. Or he, she, or it has to do something. That is, we change the form of have. Or you can simply use must and it stays the same. It does not matter the subject. I must, you, we, or they must, he, she, or it must. Also in the future. In the future, we use the future helping verb will and have to, and we leave have as it is. I will have to. You, we, or they will have to. He, she, or it will have to. Or you can simply say, tomorrow I must. Next week, you, we, or they must. Next month, he, she, or it must. However, if you are talking about the past, then we have to use have to, or we must use have to. So we say, I had to, because had is the past tense form of have. You, we, or they had to, or he, she, or it had to. So talking about last week, Mr. Smith had to start physiotherapy with his walker so he did not lose mobility. Ms. Hill had to use the wheelchair again last week. She was still too weak to stand. Now she's better. But now let's come to the negative. And the negative, when talking about must and obligation, is completely different. Why? I will explain more about that in the next tutorial, quick tutorial 20. But for now, just accept that if you're talking about obligation in a negative sense, what we say is either not allowed or not permitted to. So for example, last week, Mr. Smith was not allowed to stay in bed the whole day. He had to ambulate. You can also say Mr. Smith was not permitted to stay in bed the whole day. He had to ambulate. Ms. Hill, this is last week still, last week, Ms. Hill wasn't allowed to use a walker. She was still too weak to stand. So here's a little quiz for you. You have a patient, Jenny R. She had inner ear problems and vertigo. So there's poor Jenny with her swinging head. And these are the main points of her case. Last 2 months, no driving. Today, returning for a checkup. And in the future, if she has more attacks, no driving once again. So how would Jenny discuss her obligations in the last 2 months, today, and in the future? Well, you should have said, the last 2 months, I was not allowed to drive. And remember, this is Jenny. Then today, she says, today I must see the doctor for another checkup. And talking about the future, if I get more attacks in the future, I must stop driving again. So we see here, must use in the present, must use in the future, but if she's talking about, when she's talking about the last 2 months, was not allowed to. That's it for now. Bye.